Hello, everyone, and welcome to a lightning talk on community action, climate change, and health in SIDS, prioritizing community-driven development, looking at the governance, the tensions and governance between global norms and local needs. And I am Michelle Scobie, Senior Lecturer at the Institute of International Relations, University of the West Indies here in Trinidad and Tobago. And my areas of focus are in global environmental governance and international law, particularly from the perspective of small island developing states. So I'm coming at this as a governance scholar. I'm pleased to present this paper together with my colleague Sonia May from the Norwegian Institute of Public Health, Professor Ilan Kelman from the University College London, as well as Saskia Hirsch, a student at the Institute for Global Health at the University College London. And this is part of the research done out of a Belmont project that's funding the understandings of community action, particularly related to climate and health. So we're very pleased to discuss our paper with you. And obviously, climate change is something that is very important for many sustainability agendas, also too for health. And often we find that persons outside of the region shape or responsible for the agendas of SIDS. So we wanted to speak with the people on the ground. And the first slide actually showed Trinidad and Tobago and Toco, which is the rural community in the northeast of the country that we focused our research on. And we recognize that there has been this normative shift towards mainstreaming climate policy and health governance. And that is supported, of course, as well by the 2030 development agenda. And in Trinidad and Tobago, as with other islands, we have adopted the climate health action plan to mainstream health into some of the climate and policy development. The question is, though, while this is really commendable, whether these global sustainability norms that focus on a livable future for developing states, communities, actually take resources and policy space away from the pressing immediate needs of these communities. So we wanted to examine this sort of dichotomy and this sort of tension, looking and us giving the community, the local community, a voice. So the study uses the results of semi-structured interviews with local community group leaders and members in the Toco region, and includes these communities that you see here. These each of these boxes shows the name of the community, the number of persons in that community, and their main sources of livelihood. And these communities together have many community action groups. And we went to them and asked them what were their concerns, particularly related to climate and health and more generally. And so we were able to provide rich data on the development priorities from the residents' perspectives, from the group's perspectives. We asked them what were the impacts of climate and weather on their activities, and hence whether climate change affected their health and livelihoods, and how they would like to see the norms around sustainable development shaped, especially when it comes to the governance of their communities. Our results quite quickly show something very different. There have been many negative weather impacts in the region caused by overflooding of a river, a landslide, etc. These have been going on for generations and generations. The community members don't articulate that this is something that they notice that is particularly related to climate change. In fact, only half of them even think that the environment affects their livelihoods, and many of them put priorities on other things like jobs, education, providing of facilities for local communities, etc. So this opens up debates about resource allocation and the drivers of resource allocation and community action, particularly in resource-poor sectors of small island developing states. And they resonate with some of the debates around prioritizing community-driven development agendas. So what does this all mean? In this lightning talk, obviously, we can't go into too much detail, but there's always a challenge of relating global SDG goals to the local realities. And there's that tension between global norm diffusion and local needs. And the question of whether this climate change agenda, climate change and health agenda, is a new form of neocolonialism? Or is it really driven by local needs in sustainable development? And so the challenge is how to keep local needs on the sustainable development funding agendas, because obviously funding will be as is needed, moving from climate change to health policies for our region. And the call, I guess, coming out of this research, what we found is that we need to have mechanisms to provide a greater voice to the local communities, even as the global and regional agendas are shaped, and to include these community action initiatives that are already taking place into those agendas. So thank you. I'd be more than happy to take questions at the Q&A section.